Hello, my name is Zoe and I'm one of the nurses from Bishop's Stortford Veterinary Hospital. We've had the laser for about 2 years now and I absolutely love it. I use it on quite a lot of patients, quite a lot of cases, different caseloads. One of the cases that I've used it on is Dingo here, and she absolutely loves it. She's really comfortable under it and yeah, it's helped her loads with walking normal. So our hydrotherapist noticed in her that she couldn't bend her legs very far. So with normal dogs, this part of the pad is supposed to be able to touch there. When she's really cold and when she's not been warmed up, like her paw only goes about that far as it does now. And then after the laser and when I've kind of massaged it, it actually normally goes back all the way. I don't want to do it now because it quite hurts her, but yeah, that's how far we now naturally get, which is a lot further than it was when she was first diagnosed with this.
Good.
So one of my most standout cases was one of the horses that I've treated after a castrate. His castrate wound got really infected and it was quite a big wound and it wouldn't heal. So with normal wound management for about 2 weeks, it still wasn't getting any more closed. So we started laser therapy twice a day for 5 days, and after 5 days, it was completely sealed up and looked completely healthy. One of the other cases that I personally really like is a little lovely spaniel that was very, very arthritic in her wrist, right front wrist, and she was all constantly limping. And we started treating her with the laser. She's owned by a doctor, and obviously her owner was really sceptical on how the laser was going to work for her. But we decided to give it a go, and she was baffled by the results of the laser, because she managed to actually take her to a beach for about 2-hour walk, and there was no limping during the walk, after the walk, or even days after the walk. And she's now only coming in once every 6 months to be lasered. Just when the owner notices that she starts limping slightly again, we laser her, and then she's good for another 6 months. One of the other benefits that we found is the client relationship. It gets a lot better because you spend so much time with the owners in one room, sometimes like up to half an hour, depending on how much you chat, and you see them quite regularly. So for example, we see our osteoarthritis cases up to 2 times a week. So as a nurse, it's really nice to have an alternative to medicate, instead of medicating them, to do the lasers for pain relief, or even doing surgery in some cases. So overall, I really personally love the laser. It's really changed how I approach some cases and how I make the vets think about some cases, to not just grab at medication and surgery straight away. And it's really enjoyable to do. My bond with the animals has gotten a lot closer, especially with some clients. And yeah, I just love it.